Dementia, including Alzheimer's, is a descent into a black hole that was once a human mind. For loved ones, there are only memories, now accompanied by uncertainty, fear, and the endless caregiving. But now there is a tunnel of hope and possibly even the chance of a way out.
Now, this is Talking Points on CBS News Minnesota.
Good evening and welcome to Talking Points. Dementia is an umbrella term. Alzheimer's and so many other memory crippling ailments are examples. Tonight in Talking Points, we'll show you there is new hope. Hope for new medications like Leqembi that can slow the progression of the disease, and hope in the increasing understanding that some very common and very treatable illnesses like sleep apnea and high blood pressure are linked to the onset of dementia. For all of you who have been robbed of a person you knew and loved, tonight's Talking Points is about how, in some cases, dementia, including Alzheimer's, may be treated and slowed. Let's start by hearing from a remarkable woman, not yet 50, who's been living with a form of dementia for 9 years. Well, joining us right now is Kanada Yazbek, and she has been diagnosed with MCI, or mild cognitive disorder. Is that the correct term here?
Mild cognitive impairment. Yep.
Mild cognitive impairment.
Yep.
Tell me, what is that? Because people look at you and say, she can't have dementia. This is something that's under the dementia label.
It is. It's under the umbrella of dementia. And it's really like an early stage dementia, I would say. Mostly when you just find those first kind of symptoms. Yeah. Sorry.
And in terms of what it is a form of dementia. Your family has a huge history of dementia and Alzheimer's. So you obviously were on the lookout for it. Tell us about your family history.
I am the seventh person in my family, and all younger onset except for my great grandmother. She got it later in life, but all of my grandma got it first, and then her siblings got it, and all before the age of 65. So all early onset Alzheimer's.
When did you have an aha moment with MCI? You realized it wasn't just forgetting your keys or where you place them, which happens to all of us.
It does. I was right before my 40th birthday. I was showering one morning and I knew I needed to wash my hair, and I knew what that would look like. I knew my hair would be clean. I couldn't process the actual steps in doing so. And we don't always think about the fact that, when you want to do something, there's a lot of brain triggers that happen other than just, I need to wash my hair. And so it was almost like a misfire. I just couldn't process it. And like you said, I knew because of my family history that I was always on the lookout for it. It was always, to me, more about when, not if. And so I just felt like I knew. And so I was seen around right shortly after that. I was actually at being tested during my 40th birthday. And they kind of baselined me. They knew there was a problem. And then the following year, I went back for retesting, and that's when I got my diagnosis.
Have you kind of modified your lifestyle at all to encompass all of those factors that now scientists and doctors know really are contribute to Alzheimer's and dementia, such as, for instance, hypertension, high blood pressure, those kinds of things?
Yeah, even sleeping disorders, things like that, we're seeing a lot more. Those can definitely affect us. So those are things I have to be very aware of, making sure I get enough sleep, making sure that, I'm taking care of my heart, because we know that heart health does affect brain health. And so those are kind of important things. My actual day-to-day life, we definitely have made some modifications. I don't drive very often, if at all.
And you left your job. You're not yet 50, and you left your job as a realtor, and I bet you were probably pretty good.
Thank you. I loved it for sure. Yeah, I'd done it for 20 years, and I did. A year ago, I left my job full time, and now I am just taking care of a couple babies for my best friend. She has 2 young children, and it's wonderful, but it is different than I anticipated.
And you and your husband have 3 younger kids, 10-year-old twins, And a 12-year-old, that's a lot of work,
It
no matter
is.
what you're doing, if you're working in or outside of the home. So kudos
It
to
is.
you.
Thank you.
Are you hopeful to get some of this medication that is available now that's been shown, proven, and FDA approved for dementia?
Absolutely. I'm looking very forward to it. And I know that uh, there'll be lots of other things coming. I'm very hopeful of that. And yeah, I think for me, the hope is that word right there.
Okay.
I'm definitely hopeful.
And we're so grateful to you for sharing this. Why are you being so open and sharing, not just with us, but with other news outlets as well? It seems you're willing to talk to anybody who wants to listen about this topic.
I am. Congressman Emmer once testified on the floor that I will tell anybody, anytime, anywhere, and that's 100% true. And the reason for that is because it's a very isolating and lonely disease, and we didn't have people. We didn't have the Alzheimer's Association the first 10 years that my family was navigating this. And I want people to know that my diagnosis, while it's changed things in my life, it's not who I am. It's just a part of me now, and that I am hopeful. Right? I am hopeful for the future, and I um, am hopeful that we'll have a cure and treat better treatments. That's what we've been working towards for so long, and it doesn't define who I am. I have a hashtag that I use. I have it, not it me, um, because it's really important. I think sometimes when people get these diagnoses, it can it's just devastating. And so I just want people to know they're not alone and that there is hope and there's tons of resources. So
Thank you so much. You did a wonderful job. We really appreciate it.
thank you.
Up next, a Mayo Clinic doctor with new information you need to know that can help prevent dementia. Well, joining us right now is Dr. Hugo Botha. He is an assistant professor of neurology at the Mayo Clinic. Thank you so much for coming on this morning.
Thank you for having me. I'm glad to be here.
All right. Tell us essentially what you are studying, what your research is looking at in terms of AI, artificial intelligence.
Well, I'm a behavioral neurologist, so that's the part of neurology that deals mostly with memory loss and behavioral changes. And we think that a big part of the future in that field does involve AI because it's a way for us to take highly specialized knowledge, say, for instance, what we have here at Mayo Clinic, and try and build an algorithm around it that we can then use outside of Mayo Clinic and help patients that maybe cannot travel to Mayo Clinic or maybe don't even live in the US that need care locally. So that's a lot of the research that I'm involved with is basically trying to package our expertise, if you want to think about it that way, in an algorithm that can take some information from a patient and then provide some insight as if they're having
what is the goal though in terms of what this AI could do? Is it to identify the disease, to mark the progression? Is there any way of slowing it down, do you think?
Well, I think most of the work right now is trying to identify it accurately. And most of the AI work involves better diagnosis, earlier diagnosis, and then more fine-grained tracking of the disease. Separate from the AI work, there's obviously a lot of advances to try and slow down all of these progressive brain diseases. And I think it's worth explicitly connecting the two because in general, it seems that if we can get a more accurate diagnosis, we can implement more specific treatments. And if we do so earlier, people tend to do better. So they are linked
Yeah,
in that
well,
way.
let me ask you about the earlier diagnosis because I think what everybody, I think most people have seen somebody go through this and it's just so devastating. Are there things now that can slow the progression and how do they work?
That's an excellent question. So I want to just clarify one thing. When we talk about, say, dementia, we use that as a broad term, and there are many different things that can contribute to dementia. Dementia means that someone has a problem with their memory and thinking that's impacting their everyday life, that's degrading their independence. And so the most common cause of dementia in the US is Alzheimer's, but there are many other things that can cause dementia too. And in general, if someone has dementia, it is probably due to a combination of things. Some of those things may be easily treatable. So for instance, if some of someone's cognitive impairment is due to something like sleep apnea, we have good treatments for that. If someone's dementia is
I'm
largely,
sorry, sleep apnea can actually cause an early level of dementia?
so I think the way to think about it is that everyone's dementia will be multifactorial. So there'll be some elements of it, maybe a small contribution that's easy to treat in the form of sleep apnea. And maybe there's another contribution that's vascular disease, if the person has had some strokes, and we have ways to reduce someone's stroke risk. And then there may be components, say Alzheimer's disease, that we don't have a cure for, but we do have medications now that have been shown to slow down the progression of Alzheimer's. So I would think about it as always being a multifactorial thing. And part of getting that early diagnosis is figuring out which components of this person's dementia can we intervene on. And we want to do that early. That's the goal.
What I didn't know that there was a connection between sleep apnea and dementia. It sounds like you're saying there definitely is.
So all of those vascular risk factors, so things like sleep apnea, hypertension, smoking, high cholesterol, lack of activity, diabetes, all of those things have been associated with an increased risk of dementia. And reducing those risk factors have also been associated with a lower risk of developing dementia. So we think about these as little components that are contributing to someone's risk of dementia, or even in someone that has dementia, contributing to the degree of cognitive impairment that they're experiencing.
Well, that's what you're saying is hypertension. The diseases that you mentioned are some of the most common diseases that exist. Hypertension being high blood pressure. When it's identified, obviously there are treatments for sleep apnea. Obviously there are treatments for hypertension. Are there any new medications for people who are already there, who are already having, the mild cognitive impairment or some form of cognitive impairment?
Yes, there are things that we can do, and it depends on the underlying cause. So for instance, the most common cause for dementia in the US is Alzheimer's disease. And there are new Alzheimer's medications. And the way they work is they basically use the body's immune system, and they harness the immune system to try and remove some of the proteins that are associated with Alzheimer's disease. And in the drug studies, when the immune system removes these Alzheimer's proteins, people progressed more slowly. So they got worse more slowly. It's not a cure, and people didn't get better. Those are obviously still research goals, but just slowing down the disease can massively impact someone's quality of life and reduce the burden on a whole family.
And what are some of these relatively new medications?
So the one that's made it to the market now is called lecanemab or Leqembi. That's the only one that's widely available right now. The anticipation is that there are other medications that work like Leqembi that'll become available in the future, but those are still being reviewed by the FDA.
I guess when I hear you speak, I can't help but think of maybe a family out there who will be watching this, who has somebody who they wonder about. Are they on the path towards dementia? It sounds like what you're saying is that there is help available, but early diagnosis really helps if you can get them on that medication sooner.
Yes, I think that is a critical point. So sometimes patients or family members are under the impression that because there isn't anything that can be done, there isn't much of a point of speaking to your primary care doctor or undergoing a lot of tests, but that cannot be further from the truth. Getting an accurate diagnosis is critical, and doing so early is even more important, because then we can figure out what are the things that are causing this person's problems and what can we do about them.
Let me ask you, because they're all over TV, is these ads for supplements to improve your memory. Just in general, do those work?
I think it's hard to make a broad statement on whether or not they work because most of these have not been studied. But on average, a lot of those supplements contain vitamins and simple things that you would usually get enough of in your diet or if you take a daily multivitamin. There are some of them that contain herbal remedies that just haven't been studied yet, and so we don't know if they work. And it is important for people to know that the barrier of getting a supplement on the market is much, much lower than getting a drug through the FDA. And so the regulation is not as tight. And oftentimes we don't know if something works or if it's safe. So I think it's always good to talk to your primary care doctor or your neurologist if you have one about these, or to go to reputable websites, so hospitals that you trust or the National Institutes of Health, and see what they have to say about this specific supplement.
And then going back to the diseases, those common diseases that you mentioned, hypertension, if you could just list those again, because I think it
Yes,
sounds what you're saying is if you have one of those, get treated quickly because
yes.
it could affect you.
That's right. So there have been a couple of big studies that have looked at lifestyle things that contribute to risk of dementia. And in general, the ones that are identified are high blood pressure or hypertension, smoking, lack of physical activity or being sedentary, poor diet, and then lack of community engagement and cognitive stimulation. So things like loneliness have been associated with an increased risk too. So if you look at those things and you look at, say, Minnesota, something like a third of people in Minnesota that are a little bit older have high blood pressure. Something like 1 in 10 people smoke. Something like 1 in 10 people in Minnesota have diabetes if they're of that age. So those are all actionable risk factors that I think people can work on with the goal of reducing their personal risk of developing dementia.
All right. Well, Dr. Hugo Botha, thank you so much. Really interesting information. We really appreciate your time.
You're welcome. Thanks for having me.
Coming up, the help that is out there for both patients and caregivers from the Alzheimer's Association. Joining us right now is Susan Parriott. She is the CEO of the Alzheimer's Association Minnesota North Dakota chapter. And in addition, you also oversee the chapters in Iowa, Wisconsin, South Dakota, and Nebraska. So you've got a big territory you got to look out for.
I do, but I have lots of help and lots of good people that are behind this mission.
And you've been doing this for 12 years, so you've seen some changes. I want to get into that. But first of all, share the information about your hotline, who it's available to, when it's available, and what kinds of questions they can help with.
Thank you, Esme, for asking that. This is one of our biggest resources, and I love this service. We have a 24/7 helpline, so you can call at any time, day or night, to ask the question, whether it's just, I'm seeing these kinds of signs and I wonder what I should do. I have really serious questions about behavior. I'm just looking for a support group. And this helpline is answered in 200 languages. So we are really there to support all people through this disease.
24/7.
24/7, yes.
Okay, and why don't you give us that number, because we're going to put it on the screen as well.
Absolutely. It is 800-272-3900.
Okay. You've been at this for 12 years, and before the interview started, you said there's real hope out there. Tell us about that.
There is, and I'm excited. I've always had hope that we were going to find treatments and prevention methods and eventually a cure for this disease. But it has really changed in the last couple of years because we now have drugs that are available to help actually change and slow down the progression of the disease, so people can keep and maintain their cognition longer and keep creating memories. There's also blood tests that are on the horizon, and bigger yet, we are learning every day ways to reduce our risk for Alzheimer's and other forms of dementia. And that's what we really want. We never really want to have the disease to begin with. So how do we reduce our risk so that we never get Alzheimer's disease?
And scientists and doctors are still saying genetics is a big deal. There are genetics evidence that if you have somebody, an immediate family member, you are more at risk. But also, there are lifestyle issues and other issues, medical issues, that can easily be addressed. And that's a real difference, isn't it?
It is a real difference. Just watching what you eat, diet, exercise, maintaining your brain so that you stay engaged socially, make sure that you get plenty of sleep. Sleep is a huge impact on our brain. But hearing, there was a a research that came out there was a research study that came out last year that showed that if you get your hearing corrected and get hearing aids if you need it, you can reduce your risk for Alzheimer's disease by 30%. Making sure that your blood pressure is maintained at a level of 120 or lower. There's lots of things that we can do that impact our risk for Alzheimer's disease.
All right. In addition to the helpline, what else is available for both patients and caretakers from you folks in terms of resources, suggestions, recommendations, places to go, that kind of thing?
Yes. Well, we have support groups all across our 2 states and in fact, all across the country. Many of our support groups are in person, but we also have online support groups if that makes it easier for someone.
I mean, like a virtual support group.
Yes. Yes. So sometimes, a person isn't able to leave their house. That makes it challenging. So you can join a virtual support group. Okay. We have education classes that we not only bring into the community, we have a lot of volunteers that help us deliver that education across our 2 states and our territories. But we also do virtual education. Again, you can access that anytime, day or night, if that's what you are looking for. We also provide a lot of support and resources to health clinics and health systems, helping them to diagnose better, making sure that people have access to the resources and that they know what's available so that they can refer people onto our organization and to other supports within the local community.
Well, Susan Parriott, thank you so much. Great information, and we certainly appreciate your time.
Oh, thank you so much. It's such an important mission and impacts all of us that we appreciate you bringing even more awareness to this cause.
And that does it for this edition of Talking Points. As always, please email me with comments and suggestions at esme@wcco.com. This show streams every Wednesday and Thursday at 6:30 and 9:30 p.m. On Friday, it posts to YouTube for on-demand viewing. Thank you so much for watching. I'm Esme Murphy, WCCO News.